Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we're welcoming April Kyle, who is the president and CEO of the Southcentral Foundation. Thank you so much for being here.
Thank you.
And so we had a fantastic conversation with you, listening to how relationship and story-centered care can really be the root of an amazing outcomes-driven healthcare system. With that, Apoorv, you have a final question. So one question, take it away.
Yes, and I know I only have one question, although I'm tempted to ask two questions. But April, here's the thing. It's in a very small way. I guess I'm thinking very parochially because I'm a physician, and all throughout our interview, I kept hearing this incredible, ideas and concepts that you brought to life about community, relationship-centered care, teams, and the people. But I didn't hear doctor-patient relationship at any point, which is kind of interesting. I don't think that that's by neglect. As far as I understand, SCF, actually Southcentral Foundation, has actually changed the nature of that relationship because it's much more around team-based care. So I'm hoping you can elucidate that a little bit more. And do you think we lost something in the process because of that doctor-patient relationship changed, or or did we gain something else in the process because now it's more oriented around the whole team and the whole person?
So I'm going to use primary care as the place to give that answer, but we could talk about different parts of our system. So in primary care, we are asking our primary care providers to really be in relationship with a primary care team, nurse, case management, support, which is an Alaska Native person, and CMA. They sit together, they're tasked with accomplishing the same set of dashboards together, and to really value that each of those members of that team is going to bring a different part of how that team achieves those goals. And of course, there's clinical hierarchy, but we're asking them to take off those hats and sit in real relationship with each other. We're also asking that the relationship between the primary care team and primary care provider and the family be different. So typically in healthcare, it's a hierarchical relationship. And if we want to be in true partnership, then that means that we want to value that the primary care provider is bringing all of this education and expertise and life experience. And guess what? The customer owner, who is a mom or a daughter or a father or a nephew, is bringing all of this life experience and expertise to the table. And if they can trust each other, believe in each other, know each other's story, care about each other, put the real conversations on the table together, then we can get past like, oh, let me diagnose something today. And we can get to, can I walk with you? Can I be invited into your story? Can I walk with you sort of in your journey?
That's fantastic. That actually reminds me of some conversations that we've had with people around trauma-informed care, because so much of it was that. It was removing the hierarchy and really just getting to know those people, hearing their story and taking, okay, this is how we typically do it off the table, and really working with them. So it's fantastic that you're translating that to the primary care setting and saying, okay, the wellness end before we get to you've had this trauma in a healthcare setting. Thank you so much. This was fantastic. I loved this conversation.
Thank you. Appreciate being here. Thank you for listening to the story of Alaska Native people in our region.
Thank you all for watching. We'll talk to you soon. Bye-bye.